Hello, welcome to the Healthy Alternatives podcast. I am Dr. Christine Sauer with DocChristine.com. Today's show is a recording of my radio show of the same name. Enjoy! Good afternoon, this is Dr. Christine Sauer, your host of the show Healthy Alternatives, here on 97.5 CIOE FM, with live stream on communityradio.ca every Thursday at 12 noon Atlantic Standard Time. Thanks for tuning in today. In this show, I will talk, mostly with guests, about all aspects of health, healthcare and wellness, from conventional to alternative and everything in between. My mission for this radio show is to help change people's lives for the better by informing them about different options to get and stay healthy and well, so they can choose for themselves which option might work in their case. And if you feel you are stuck in a dark place, I want to tell you, don't give up. There's a light at the end of the tunnel for you too. Today, I'm very pleased to be back with Fanny Atomza of Fanny Atomza. She is not only a registered massage therapist, but also a birth doula.
Yes.
And we will talk about what a birth doula is, what they do, and why they are so important in this show. But Fanny, you are all Fanny. Sorry, I always say funny. You can be funny, but you can be serious too.
Yes.
So I should say Fanny.
Fanny.
So you are the owner of Blue Nile Massage and Wellness.
Yeah.
Where is it located?
Well, I work from home actually, and I'm
Nice.
just in the Lacewood area, just in Clayton Park.
In Halifax, Clayton Park.
Yes.
Wonderful.
Yeah.
And it's therapeutic massage. So please don't confuse that. We talked in the first show about that. That's
Yeah.
a real massage, the helpful and healing massage.
Absolutely.
Now, welcome to the show again.
Thank you so much.
Tell me a little bit about your story again for those who didn't watch the first part.
Sure.
And tell us where you come from and how you grew up and
Yeah.
how you actually got into being a birth doula.
Okay, definitely. So I originally am from Ethiopia. My parents are from Ethiopia. And we came to Halifax in 91. I grew up in the north end of Halifax, which, even though I don't live there anymore, it's still a big part of my heart, a big part of how I grew up. So
North End is a very tight-knit community.
very much so. Big sense of community, diversity, very close-knit community.
So what school did you go to?
For elementary, I went to St. Joseph's A. McKay, and then junior high, I went to Highland Park, and then I went to QE the last year before it shut down, and then we went to Citadel.
All over the place.
All over the map, honestly, all over the map. Yeah, and so, I took a CCA program, so I was a healthcare provider, like a personal care worker.
You did that?
For some time, yes,
Yeah.
exactly. And then I was more interested in...
And actually, our last show was about CCAs.
Oh, wow.
Yeah,
it's very important work.
Yeah, with the lady that had this show previously on Thursdays with Debbie Nickerson.
Okay.
Yeah, she had that before. She's a nurse and she is now teaching CCA
wow.
assistants.
Yes.
She's
very
great.
Important work. Very
Yeah.
important work.
Now you got that, and then what did you do then? You wanted to study social work. You
That
shared.
was the plan. Yeah, that was the original plan. And as I was waiting to get into the program, I was really eager to start school, and so I decided to take this program. And, I had an interest in alternative health, preventative health, being a CCA. And then I just fell in love with it. I fell in love with massage therapy, absolutely.
How did you get into massage therapy? Why massage therapy and not, God knows, chiropractic?
Something else? Yeah. Well, a friend actually had just taken the program, and she recommended it to me. And subconsciously, I knew about the effectiveness of touch and the power of touch. Just growing up, my parents were very hands-on. And so I think it was just a natural selection for me to choose massage therapy.
No, that's really wonderful because many people don't have that touch, and it is so important. Not the touch or the therapeutic effects, both are very therapeutic and healful.
Absolutely.
So it's funny sometimes how things happen.
Yeah.
How a turn in our life pushes us in a totally new direction.
Honestly. Absolutely.
And those who know me a little better and know my story know that it happened to me a few times in my life. And I hope it will happen again, although sometimes it's not pleasant. And tell me about how you ended up taking an additional education as a birth doula.
Doula, yeah, of course.
And what it is.
Yeah. So birth doula is basically a title that you can give to somebody who has done the training, but really it's something that has been practiced in my community in particular since the beginning of time. So, that's the Black community, the African community. We always have our aunts around and our sisters around and our grandmothers around. So it's just a support that you have during pregnancy, birth, and delivery. And then postpartum for some time. So a birth doula basically gets that training, that certification. And then
what does it encompass? What is it exactly? What do you learn besides anatomy and physiology?
Yeah, they touch on anatomy and physiology, but it's more about care and comfort. So most people, I also have a child, so it was
how old is he or she?
He is 9, so he's a big boy. But the memories that you have of birth and your experience with birth always stay with you. So it doesn't matter how many years it's been, you always can remember if it was a positive or a negative experience.
I remember, I have 2 sons, they're 38 and 37. I still remember the time and the birth experience.
Absolutely. And what birth doulas want to do is we just want to make it a more positive experience, even if it's something as simple as giving you a back rub or fetching you something to eat or taking being there as a support not only to you but to your partner as well if there's other kids that are involved, and also to be a voice for you, to be an advocate for you, because in those moments it's difficult to speak if you're in pain or
yes or I remember screaming at some point.
This is it, yeah,
because giving birth, we can say whatever you want, it hurts, and it hurts a lot.
Absolutely. And things can change quite suddenly. You might have a plan in place, and then, you need interventions, whichever that may be. And so it's nice to have someone that knows you and that you trust and that you can speak on your behalf during those times. So that's what birth doulas do.
That is a wonderful profession, really, because I don't know if you're aware of that, but in Germany we had birth doulas also.
Yeah,
they are actually part of the hospital.
I know.
And they come and visit you afterwards and make sure that you know how to care for the baby and make sure that you are okay and know how to give the breast to your child and breastfeed it, which is not that easy as it sounds.
Oh, no.
It can hurt, it can get inflamed, you can get all kinds of complications.
Yeah, and you don't know what's normal and not normal, and especially if it's your first time.
Right.
It can be very intimidating, so that's why we're there.
Now, you're a doula for a little bit, but of course from your heritage you're always familiar with it.
Absolutely, yeah.
So do you ever go back to Ethiopia and see how it goes there and watch the birth actually there?
Not back home.
Oh.
I haven't back home. But I've certainly been around. Well, my friends have given birth. My sister-in-law has given birth to 4 kids. We've been there with her throughout that process. And, the last time I was back home was before my son was born. So that was 10 years. Hopefully next year.
Because I learned that in those countries where the medical community is not that frequent, that they give birth, just they go behind a bush and squat and then the child is born. I don't think it's that easy, but
right, yeah, and it's. I mean, it can be very home based. It can be within the home, but I mean, there's lots of really developed facilities as well. I think it just comes down to personal preference. Like if you want to have the doctors involved, if you want nurses involved, or if you want more nurturing, more caring, private, comforting experiences.
Now, in the second part of this show, we'll talk a little bit more about the details, how a birth doula can make the whole birthing process easier, while still making sure that it's safe, because you don't want a home birth if the child it ends up with cerebral palsy because it has oxygen deficiency.
Absolutely.
So a birth doula does not only provide comfort, but in certain cases has to take action and then say, no, you have to go to the hospital right now. You need a C-section immediately.
Yeah, and I should clarify that birth doulas do not deliver babies. We are not midwives. So
really?
Yes.
Okay.
So we don't deliver the baby. So there's always somebody present with us. So if you just choose to have a home birth, there would be a midwife present.
Okay.
Or we will be there at the hospital with your doctor and your nurses. So we're just there as a support.
That's interesting, because I think many people have no idea that those two are completely different.
Exactly, yeah.
And this brings us to the end of the first half of today's show here on 97.5 CIOE FM. Please tune in after the commercial break for more about giving birth with Fanny. Hello and welcome back to Healthy Alternatives here on 97.5 CIOE FM or on the web at communityradio.ca. I'm your host, Dr. Christine Sauer, and today I'm talking with Fanny of Fanny Atomsa, I apologize, about something that's not very funny. It is actually pregnancy, birth, and afterwards it may be funny when you have the baby home and it groans and laughs.
Then it might be a little funny.
And we were just talking in the break a little bit about our birth experiences and that they're not always pleasant. But I always say, although it hurts a lot, it's the only type of pain where you get rewarded for. And when it ends and you have the baby in your arms, you forget all the pain.
Oh, yeah.
It's gone.
Absolutely.
So that's a big difference between pain, say, after surgery or even worse of cancer, and pain of birth.
Yeah, exactly.
So tell me a little bit about the birth you witnessed. How did it go, and what exactly does a doula do as compared with a midwife? Because those get often confused.
Yeah, I mean, I've seen, my own birth. I got my sister to videotape that.
Oh, wow.
She decided not to have kids after seeing that. So, I mean, it can be a beautiful thing. Some people, it's not the most pleasant thing, but yeah, and then,
there's certainly blood and gore involved.
Yeah, absolutely. Absolutely. All the insides. And
so you watched a few birth experiences of other people,
yes.
And what did you do before the birth while they were pregnant, and what did you do during the birth and afterwards?
Yeah, helping people to stay active, helping people to eat well.
During the pregnancy?
During pregnancy and after. I can speak on my own experience. In our culture, once you have the kids, after you've given birth, the women bring the most heartiest and filling foods, so you don't have to cook for a very long time.
Nice.
But it's food that's, I would say, high in carbs and high in fat in order to allow you to regain your strength and your energy to support your new life as a mom.
Probably protein too, to make
absolutely.
the mother's milk and rebuild your damaged tissues.
Absolutely, yeah, exactly. Yeah, that was our experience, and that's kind of what birth doulas do as well. We can kind of come in and postpartum, watch the baby for a couple of hours while you take a shower or kind of take care of yourself a little bit. We support you in coming up with a postpartum plan in terms of delegating tasks to people. You don't think about those things sometimes, but once the baby's in your arms, it's you want to know who's going to do your laundry, who's going to help cut up the vegetables and help with supper, especially if your partner is at work and those types of things. So
I know how that is because I was in that situation. Nobody helped me, and I had the baby on my hip.
Right, when you're doing all of that.
Right, either it was sleeping or I had it on my hip. And then when I had 2 kids, 15 months apart, I had both on the hip.
Wow.
And I needed a massage after that.
That's something birth doulas do as well. We know all these soothing techniques, massage, when to use heat, when to use cold, when to use hydrotherapy, hot tubs, that kind of thing.
Now, do many people give birth in water or want to do that?
Yeah, absolutely. I haven't seen one live, but part of the training we got to witness a live birth through video, and that was absolutely beautiful. They say babies come out and they already know how to swim, and plus you get a free wash before the baby comes onto your chest. So, I mean,
some people are afraid that once a baby comes out, it suffocates because it's underwater.
Yeah, because the baby's still attached to the umbilical cord. I think that's the main part that provides the safety and the nourishment. So
and it doesn't take very long that you take it out. Once it's slipped out, then it comes out of the water, takes its first breath, and it must be painful to have the first breath. Because for the baby, because I always think in utero they drink and inhale the amniotic fluid. Once they are out, their lungs are still collapsed,
right?
And then it inflates those collapsed lungs. No wonder they scream.
Wow. I never thought of that. Wow.
And I know for centuries they thought babies don't feel pain. Were they ever wrong? I remember in the Middle Ages or even in the 18th, 19th century they did surgery on newborns with no anesthesia.
Oh, wow.
And now we know that is really torture.
Oh my God.
Yeah, they did all that stuff, and I studied history of medicine. I love it.
Would, yeah.
And a doula and a midwife together, I think, can give so much comfort and safety to a woman.
Definitely, yeah.
And what do you do before? I mean, pregnancy massage is nice.
Yeah, pregnancy, birth doulas help to come up with a plan, a birth plan. We consider, there's a whole booklet that we would go through with the pregnant person. There's a lot of questions. There's an interview process that takes place. So they basically, the person who's interested in doula would obviously interview us. We would give them references, tell them about our training. And we also provide them with information, and we have to ask them questions as well. So birth plans are very important. Like I mentioned, things can take a turn at any point. So you always want to be prepared, have a backup plan, and, prepare for the worst, but hope for the best.
Yeah, all big events get planned. I mean, how long do people plan a wedding? Why shouldn't they plan their birth?
Absolutely.
And sometimes it turns out differently. Sometimes the husband leaves in the middle of the wedding or the bride runs away.
Yeah.
And sometimes you plan a home birth and it's all beautiful and nice and you end up having a C-section.
Absolutely.
And that can be very disappointing for the mother.
Yep, exactly.
And what does the doula do to comfort the mother in those cases?
Well, we remind them. We pull out the birth plan. We remind them, I know that this is what you wanted, but we do have a backup plan. Your safety is the most important thing. Baby safety is the most important thing. Just reassuring them, just being there with them. This is another instance where touch might be really important. Maybe they might not want touch at all. So that's why building that rapport is really important beforehand. So you kind of get to know each other a little bit better. But yeah, just a reassurance. And the birth plan itself creates a lot of confidence and less confusion, because when you have something in place before it, you have a better understanding of what to expect and where things are going to go. So it creates a lot of comfort.
And that's important, especially if it's your first child, and many women are afraid of it because they heard the terrible experiences from some relatives that sometimes make it worse than it is. I mean, it is always nice to be rewarded with a little baby.
Yeah, yeah.
And I feel sad for the women that choose not to have children because they are afraid of the birth.
Yeah, yeah, yeah. It's your body will know what to do. That's the most amazing thing about our bodies, because I know even my own experience, even if I was not ready, but my body was ready. It was going to do it regardless if I was ready or not. So
And that's fascinating. And I always say, trust your body
Absolutely.
and trust your inner voice. This little inner voice, the intuition that tells you it's time. So before we quit the show, before the end of the show, tell us how people can get in contact with you. What's your website?
My website is www.BlueNile, that's BlueNile, massagetherapy.com. I'm also on Instagram at bluenile.massagetherapy. And you can find me on Facebook at Blue Nile Massage and Wellness.
Now that's wonderful. So if you're looking for a sweet doula that also knows massage therapy, consider Fanny.
Yes, absolutely.
Fanny. Sorry about that. Thank you so much for being on the show today.
Thank you.
And this brings me to the end of today's show. And please don't hesitate to contact me with any questions, thoughts, comments, or suggestions. Or if you'd like to contact Fanny and forgot a website, my email here is christine@communityradio.ca, or you can contact me through my website, docchristine.com. And I'm always grateful for any feedback. I also want to extend a special thank you to today's producer, Cecil Wright. You're the best. You might not know this, but this is a volunteer-run non-profit radio station, and we even have an art gallery. The only one in Canada, I heard. If you're local and you'd like to drop in, we are at 11 Glendale Avenue, Lower Sackville, Nova Scotia. Thank you all for listening to Healthy Alternatives. I'm your host, Dr. Christine Sauer. Tune in next Thursday at noon on 97.5 CIOE FM Community Radio with live stream on communityradio.ca for the next episode. Goodbye and have a great day.